Good evening. You are listening to Bold Moves Radio. The show is Prudent Woman with myself, Rhulani Baloyi. You are most welcome. Tonight we are excited. We once more have our doctor as we continue with our talk on health issues. Last week we were talking on the dangers of self-medication. We shall continue to recap on the dangers of self-medication because there was a lot of interest that we had, a number of questions that were not answered, and we felt this is a very important topic. We need to get the prudent women to be well informed so that we can look after ourselves as well as our families. Tonight's topic, we are talking on how to deal with the fears of medical procedures. You will all agree with me, most of us, we have lost a number of our loved ones because they kept quiet even when they're diagnosed with medical conditions that could have been sorted out going through medical procedures. But most of us, we tend to keep quiet because we are fearful. More especially, I know we are fearful of going through surgery, having the anesthetist taking us through, where, there's a lot of myths around it. Most of us believe I will not wake up. So tonight, ladies, gentlemen, everyone who has joined us, be with us. We are going to talk to our lovely doctor, Dr. Tsakani Masingi. She will once more be taking us through how to deal with those fears by empowering us, by giving us information on what is it that they do when we go through medical procedures. Because most of the time, I believe one is fearful because you do not have knowledge on what is expected. But when you know what to expect, you cannot be fearful because you look forward to it. But before I welcome Dr. Masingi, ladies, I would like to remind you, we're counting 4 days to go. Abigail Arise Conference. I still invite you. On Friday, let us come and take off the stress, enjoy ourselves. This is the Mental Health Awareness Month. We can only take care of our mental health when you love yourself. So on a Friday, the 15th, I invite you, come in your evening dresses, enjoy yourselves as we go on having a gala dinner for Abigail Arise at Mana Tabernacle. I still invite you, those who have not yet registered, you are still welcome. Register. It's only 200 rands for the gala dinner and for the conference on Saturday. On Saturday, we're going to have empowerment sessions. Even young girls, ladies, youth, you will have your own sessions where we will have specialists who will take you through to empower you on how to become a prudent young woman, on how to become a prudent youth, as we arise, and we call ourselves Abigails because Abigail was a wise woman who knew how to respond at the right season. So I still invite you. It's only 4 days to go. If you are not at Mana Tabernacle or not closer to Polokwane, you can register with us by sending your details to 081-358-8745. Send us your names and then we'll talk on how you make your payment, and you are welcome. As long as you have registered, for us to be able to take care of the logistics, you can come through and pay on a Saturday or on Friday when you come through for the gala dinner. But we are looking forward. We are excited because we're going to enjoy ourselves. We're going to love ourselves as women coming this Saturday. The whole weekend, Friday until Sunday, we'll be enjoying ourselves. Dr. Tsakani, we would like to welcome you and we would like to thank you for giving yourself time to come and continue to talk to us about issues which are very important for us to take care of our bodies. We can have all the information, we can be educated, we can start businesses, but what is key is how healthy are you to be able to use this body that the Lord has given us as our house to continue to be a blessing in this world. We would like to welcome you, Dr. Tsakani. You can greet our audience.
Thank you, Sister Rhulani. Indeed, health is wealth. So it's good to be back here once more to be talking to all the Prudent women out there and to all the Bold Move radio listeners. I'm happy to be back. I'm Dr. Mhlari Tsakani Masingi. I'm here to deal with all the health issues so that we are wealthy in our lives and in our community. So thank you so much, Rhulani.
Thank you, Dr. Tsakani. And as I indicated, last week's show raised a lot of interest. We had a number of questions that we could not get through to, and because of our time limitations. So because it's a very important topic, I would like us to recap on it, Dr. Tsakani, if you agree, to take through the questions that came through after the show and even the ones that came through during the show, because we felt they were very important. We need to look at them. One question that came through, which we felt we could not get through it during that session, was a question around immune boosters. We did talk on immune boosters, that they are important, you can take them, but someone asked, how long should one take immune boosters?
Thank you so much. Immune boosters, basically we are trying to improve our immune system. So immune boosters, they can be in a form of food, just basic food. You don't even have to take tablets. So it could be in a form of healthy living. If you consult a dietitian, they will tell you almost all the fruits and vegetables, we do have all those vitamins that they are already in the immune boosters tablets. So if you eat healthy, according to follow the dietitians, you just take your fruits, your vegetables. There's not even a necessity basically to take those immune boosters. Basically, immune boosters, you can continue to take them for life. It could be through those capsules in a form of tablet or in a form of fruits and vegetables and through other foods that we are taking. So our dietitians, they are good in those that category to advise us on what to take. So basically, it's a lifelong issue. Yes, if you eat healthy, basically you're boosting your immunity. Yes. Yeah. And the lifestyle is very important. So another way to boost your immunity is through lifestyles, not only through drugs. So if we can teach ourselves to say, let's have a healthy living. So live healthy, sports-wise, healthy eating, and keep our mind. Let's not forget our mind. Our mind is very important as well to boost our immunity. We tend to forget the mind. Yes. If you consult the psychologist and psychiatrist, they will tell you, take care of your mind. That is number one. We may take all these immune booster drugs and what, but if you don't take care of this, the mind, the life physically, the lifestyle, and eating healthy, that's what is important. So basically, if you want to take it in that form, it means it's a lifestyle thing because you need to be healthy throughout your life. So I would say let's focus more, not on the capsule. The capsules are good, but let's focus on what we have in our garden. Let's teach our children, let's plant all these immune boosters because basically it's the vegetables that we can plant in our garden. Yes.
Yeah. Dr. Mhlari, you know, it tells me, ladies, that it's a must. You must come to the gala dinner on Friday, because that is another way of taking care of your mind, of your mental health, because you go to a place where you unstress yourself, you know, by getting together with other people. You are able to see and laugh and all that, and that's what we need. So that can be another immune booster for you to come to a place where, you know, you just come in and say, I'm going to have a good night. I'm going to be dressing well. I'm going to be eating nice. So that's another immune booster. Thank you, Dr. Mhlari. There was another question linked to that. Someone was asking us, how long can one take painkillers? Any painkiller? Because we did talk about first aid saying it's not bad to also have first aid kit in your house, but how long should one take painkillers before they think of going to see a doctor?
Thank you so much. Like we said, most of these drugs, what we prefer is prescribed medication. So, and we indicated even in the previous show that if you take medication, you see it's going for 7 days, which is a week.
Yes.
Once you go for 7 weeks, for 7 days, which is 1 week, that is now too much. You need to see a doctor. You have tried yourself, so let's go and consult so that you can get the right prescription. Because you may be thinking you are treating something else, and it's a symptom for something else, and you delay yourself.
No, thank you. Just like what you said last time, to say it's very important for one to be checked so that we can be able to get to discover all these challenges that one may be having. And it's faster to treat something when it's diagnosed early than for it to be diagnosed at a later stage. And another question, doctor, is that someone was asking, what type of medication must one have in the house? You know, something that you can say can be in your first aid kit.
Okay. So basically, number one, drugs that we must keep at home is prescribed medication. Because if we just go to a grocery shop, this drug is on sale, we tend to stock. Or some people are even here at home, my medical aid is about to expire. I mean, the year is about to end. Let me go stock on medication before. So let's tend to stay away from such, because the danger of that as well, you pile medication at home, you have young kids, then they tend to have accidental ingestion of all those drugs because we are just keeping drugs. Sometimes we tend to even stock drugs and keep at home. It even reaches expiry date. Yes. So we just keep on consuming even without even checking all those expiry. So let's keep prescribed medication, and let's keep our first kit. On the first kit, basically, you just need your bandages in case you have accidental cuts for ourselves and kids, bandages, and the other stuff for medication-wise. Yes. Let them be prescribed.
We should not stock like we did. I remember during the COVID-19 pandemic, when it was starting, some of us took medication before we were even diagnosed. We were told, start drinking. When the virus finds you, you'll already be ready.
What you need to do is the immune stuff. You see the vitamins, and that's what you need to keep yourself be ready immune-wise. If, as you said, if we are healthy, we are wealthy. So be capsule-wise or vitamin-wise in terms of the food that we ingest, that's what we need in our home cabinets, basically, to keep ourselves healthy.
No, thank you, doctor. And thank you so much for recapping. And as I promised, today we continue with a new topic on dealing with fears for medical procedures. This topic, for me, it's a very important topic because most of us, you get to a doctor, you are diagnosed, and they say, all we need is for you to come to theater to undergo such and such procedure. And immediately you come out of the medical consulting rooms, you go home and keep quiet. We have lost a number of people, doctor. I know, even myself, I've lost loved ones. For instance, you'll find that at the end, we are told they were diagnosed with cancer. And only when we start questioning their doctor to say, how is it possible that this person stage on cancer can get to this level and you have been quiet? And then the doctor pulls out a file and say, it is 5 years ago that I told your loved one that they've got this and this type of cancer, and they kept quiet. And only to realize, when they are in their final stages, they will say, it's because I was scared and I could not talk about it. And I have realized through empowering oneself to say, if you realize these challenges and accept but empower yourself in terms of what is it that you are expected to undergo. And Prudent women, as we said, we need to empower ourselves so that we are ready to respond properly when the time comes. You may not have been diagnosed now, but I've realized that when you are diagnosed, it's very difficult for you to understand what the doctor will be saying. Sometimes you even shut your ears. Someone is talking to you, but you cannot hear them because what is going on in your mind is, I'm dying. So even when these procedures are explained, you do not hear them from the professional. And the next thing, you go and retrieve the myths that we have. Doctor, there are a lot of myths that we have around procedures, which some are, I don't know, they are true. Some I've proven to myself that they are not true. And it's because we do not know. So tonight, ladies, we invite you. Let us come together. Let us stay together until 6 o'clock. Let us learn on what is it to expect when you go for a medical procedure. Doctor, I've given my understanding, but I would like to believe from your side as a professional health worker, you have come across a number of people with these fears. Probably you have even come across a client who refused, whom you saw perishing because they refused to go through these procedures. Maybe just take us through what is it in terms of your understanding that makes these people to be fearful of these procedures.
Okay. Thank you so much. Yeah, indeed, it's true that what we call pre-operative anxiety, we call it pre-operative anxiety. It's real. And when you look at research, according to the British Medical Journal, there was a recent study that was published in 2022. If you look at the prevalence, we see that it's worldwide. It's around 47%. So most people are generally scared of a surgery or coming to theater. There are various number of reasons why people will be scared of coming to surgery. Mostly is number one, fear of death, because when they think of surgery, especially anesthesia, they just think, I won't wake up from that operation table. That's the end of me. So mostly it's just fear of death, and there's a lot of myths around it. So people have heard from relatives, they get scared, they heard from friends. Some is because of religious beliefs. We do have some religious beliefs, and others factors that affect that influence this fear is tends to change of environment. So people are used to a certain environment. They don't want to leave home. They know, I'll be operated, and now it means I must leave home, stay in the hospital for 2 weeks. Who will look after my children when I'm away? So it's better I postpone this, or I don't even go at all. Others is fear of complications. They've seen others being operated and they complicated. So, and all these fears are real, because if I've seen my mother, for example, passing away from operation, I'll tend to have fears. So we need to understand that these fears are real and they must be taken into consideration. So other people is just a fear of a loss of limb, for example, that we see mostly in the hospital. People have diabetic foot, for example. So people with diabetic find that the food now have sauce and what we call diabetic food. From there, they will come and say, or somebody has bewitched them. So say, no, we need to remove this. It's going to cause sepsis, and sepsis will lead to death. But they will refuse and say, no, Ishifulana, let me go. Or some will say religious belief, let me just go to Pastor so and so. They will pray for me and I'll be healed. So we do get a lot of patients with this. So it's various factors that lead to
these phobias.
These phobias. But when I look at the studies, people are scared of death. And the surgery is supposed to help you to live. Yes.
So what I get from you, doctor, is that mainly all these phobias are because we are not informed of what is expected. And, I have realized that medical science has advanced so much. Most of us previously, when you were told of an operation, you see someone coming back home with a big scar where they've opened. But I've realized nowadays, someone will say, I've undergone an operation, and it's just a dot. That's how much medical science has advanced. And I invite you, prudent women. It means we need to take advantage of this. Mina, I believe when we have all this wisdom coming from our scientists, it's God giving them this wisdom. And only a person who comes forth and utilize this wisdom will be able to get that assistance in terms of using this wisdom to get healed. So we need to move away from listening to myths. What's important, it's you empower yourself and be open-minded and trust upon the advice that you get. Yes, of course, sometimes before you undergo, I would like to believe, doctor, it's important for one to get second opinion. But I need you to just take us through, just make us to understand the importance of early diagnosis. Because I think this is one area that most of us suffer from, and most especially us ladies, all of us. How many times do we go for checkups? They talk of breast cancer. How many of us do we even do it? We tend to shy away. You just become scared and feel, I better not know. But I better not know leads you to your early grave. Yeah. So, doctor, just take us through to just give us an indication of the importance of early diagnosis. Maybe you can show us with one diagnosis to show when you detect it early using your medical science, in these stages, you are able to take care of it.
Okay, thank you so much. As they say, prevention is better than cure. So if you can prevent something, that is best. Even diagnosing something early, it's easy to treat something that you've diagnosed early than to treat something that is already on its late stages. So if, for example, we look at the cancer, that everybody knows there's cancer, there's stages of cancer. So if they find it in stage 1, it's easy to treat because it's still confined. Let's say it's a breast cancer. It's still confined to the breast. If they say, let me operate you, remove the breast, then the cancer will be gone. But now, if it moves now, it's no longer stage 1 because with time, it progresses. The more you sit, the more it progresses. And we don't know when will it cross to stage 2 or stage 3. So you sit now, say, no, I'm still scared. Let me think about it and all these things. As we say, if you are not sure of something, let's be educated. Let me go and say, let me get a second opinion.
Yes.
So whilst it's still stage 1, for example, I go get a second opinion. It's really confirmed. This is what we are dealing with. And you deal with it there and there. So by the time you come now, say, I've thought about it, or usually what we see in the hospital, by the time the people come now, they are forced to come to the hospital because of pain or complications that are arising out of that particular condition. Now you are in stage 4 cancer. So now the pain is unbearable because if it's stage 1, it's just a little ball. No painless, so you are comfortable. So now you are coming to the hospital, not because you want to, because you are forced. You are in severe pain. Or sometimes it's even smelling. Your loved ones, they can't even stand it, the smell at home. So you are forced now to come to the hospital. So now, if you've moved from stage 1 to stage 4, that thing is no longer confirmed to the breast now. It has spread maybe to the liver, to the lungs, now to the brain. So it's even difficult to treat. There's nothing much to be done. Even if we are doing surgery, you are finally agreeing to the surgery, we are just doing what we call toileting. So we're just removing it just for the sake of pain-free and to keep you clean. So, but already now they're spread to the lungs, to the brain, for example. So, and the most common thing that we see in amongst our African patients is what I talked about, the diabetic foot. They come to the hospital, it's still sepsis, what we call sepsis infection around the toe, small toe. Then say, let's cut the toe. Say, no,
I can't.
Let me go and consult in a week's time. Now it's spreading. It's at the ankle side. Then you are still trying to say, let me think about it. By the time you come now, it has gone up closer to the knee.
It's sad, doctor, because I can attest to what you are saying. I had 2 of my loved ones, similar thing. One, we only discovered when they had severe pain. And when they went to the doctor, we asked the doctor, why did you keep this information? Pull out the file and say, 5 years ago, I told the person. And then I had another one who immediately, when it was just a lump, told us that they're saying I've got this cancer and went for procedures. That one who went for early diagnosis and went for the procedure, it's well now, you know. You cannot even tell that this person had the problem, but that other one, unfortunately, we lost the person. So this is so real. I know what you're talking about, and it's painful, you know, because as your loved one goes through such pain, you feel you should have done something. So I say, ladies, let us be prudent within our families and find a way to talk to our loved ones about these things. But doctor, I have realized that one group that is so scared of medical procedures, it's either their children, because I heard somewhere, because doctors, you put on all these things when you are coming to do a medical procedure, you find that you are dressed, and this poor child only sees the eyes and thinks, now I've got some cartoon coming for me, you know, so they don't look forward to it. But the second group, it's our men. The men are so scared of even just a needle. So I want to ask you, as a medical practitioner, how will you advise us as prudent women to present coming to see you to be enticing to these 2 groups in our families? Because I can tell you, I know every woman, wherever you are, you know, it's a struggle. When tate go haya atshwerinyana ke flu and wa ibona or yeah, it's our doctor, I am fine. I'm going to do the garden, because they're scared of coming to see you. How should we make it enticing?
Okay. So it's true. Children are scared of doctors and men. However, when it comes to operation procedures, what we are talking about, fear of procedures, according to research, actually, it's the other way around. It's females who are scared.
I'm so scared to leave my children.
For that reason, they say mostly 53%. It's females compared to males, which is males is around 47%. So so it's the other way around. It's us who are scared of performing surgeries. Yes. So men, they may be brave and say, no, I don't want to go see the doctor. But once they are told you have this diagnosis, they tend to be agreeable compared to us, because with us, they say we are scared to leave our children and family. Not that men are not scared, I'm not sure, but it seems like females.
I agree, you know, ladies, we always shift the blame. We always want someone to shift it to. So the men were the ones that were saying, you know, Rina was strong.
Yes.
But I would like to believe to go with the research that you are saying. So and we have seen most of the people, I think, in my position that I've observed who got early diagnosis but kept it to themselves were women.
Yes.
So probably that study is right.
Yes.
It was women. But let us come to this one topic, which I think you as you said last week, that you are the HOD in the province for this department. You say it's
anesthesiology.
Anesthesiology. It's very difficult for me because I've always been so scared of that. I know, doctor, that most of us, the reason we don't want to come for procedures, it's because of that. It's because we are told, when I come, you are going to perform this and it's going to kill me. So today, doctor, I just want to request you, empower us, tell us, what is it that you do? Do you kill us and then we wait to be resurrected?
Yeah, we do something like that. Yeah, we kill you and resurrect you, sort of. Yeah. Yes. So basically, anesthesia. What happens is we create an environment for surgeons. Surgeons is the doctor who operates. And another environment that we create is for you as a patient. So to be operated comfortably. So in a sense of, we take away the pain, the awareness, so you are not conscious to see what the doctor is doing. And you are pain-free. So anesthesia has 3 components. So when you say we are giving you a balanced anesthesia, so it's basically analgesia, which is pain-free.
Okay.
So you must be pain-free during the operation. So we are the gurus of pain. So and
I'm sure, ladies, that one is for us, ne? We agree.
Yes. Then we make sure that you have muscle relaxation, paralysis, so that when the doctor is operating you, the muscles are not tense. They are not pulling too much.
You are relaxed.
You are relaxed.
Okay.
Then we make sure another component is hypnosis. So hypnosis meaning you are not aware of the environment. You are either asleep. So it can include all these 3 components in some procedure of anesthesia or some of the components that I've mentioned. So basically, you need to be pain-free, relaxed, and not aware of what they are doing while they are operating. So we create a comfortable environment for you and the surgeon.
So, doctor, today you have just released me to understand what is it for. You see, because all the 3 elements that you have mentioned are actually for my benefit. Because I can just imagine if I was to do this procedure, when I'm looking at you, I will wake up and run away. If my muscles were not relaxed, of course, that would be a problem because you will have to be struggling. But if it's taking away the pain, that's a plus, because you know, there are lots of myths around it. Someone will say, I know, when I have got 3 children, all of them, I never allowed anything to be given to me to form this thing that assists me on those 3 areas that you were talking about.
Okay, thank you so much. And indeed, anesthesia is one of the things that scares people from coming to a theater to be operated. So, as I mentioned, basically, it's about education and understanding what needs to be done. If they tell you you are going for operation, please do not be scared to ask, what is my diagnosis?
Yes.
Because even people, this is what is causing all these myths. You don't even understand your diagnosis. One. Do you ask a patient you're about to put them to sleep, why are you being operated? I don't know. They say I must be operated. So you need to understand why you are being operated. you need to understand the anesthetic procedure itself. So we have what we call preoperative assessment. So we come and see you before as anesthetist, before the operation. Don't be scared. So especially as Africans, we don't like to ask questions. If you get the other races, they will tend to ask a lot of questions. So tomorrow we are saying you are operating me. What will you be doing? How will you make me sleep? All those kind of questions. So even as let's open up. Let's not be scared. I like the young generations. They will ask you all sorts of questions. So I'll be sleeping. What will you be doing to me?
And most of the time, you cannot ask when you do not know. So that's why it's important. Even if it's little information, it helps you to open up and want to know more. So that is the reason we appreciate people like you, doctor, who come forth to explain these things to us.
And I want to plead with the elderly. Let's not say yes, everything. Yes, let's ask questions. Let's understand what is it, like we ask now, what is it that you are actually doing to us? Because some are told is the light. Once you get to theater, they still those lights. Oh, that light, they said, look at the light, you are gone. So let's ask. So we have various types of anesthetics that we use. So you can either get what we call a general anesthesia, or regional anesthesia. Regional anesthesia will go into the subdivided. So a general anesthesia, basically we deal with your central nervous system. So we put you, I'll try to simplify it so that we can understand. We basically put you to sleep. You are not aware of the surrounding. You are unconscious. And you'll be pain-free. So with regional anesthesia, you are not you are conscious. The other one you are unconscious. So with regional anesthesia, you are awake. However, we block the peripheral nerve that takes the pain to that region, basically. So we just give you medication to block the peripheral nerves that transmits pain, so that they can work on you while you are awake. So some people say, what I've noticed in the hospital, hey, I'm going to give you regional anesthesia, compromise of spinal anesthesia, epidural anesthesia, or local anesthesia. So once you mention that, I'll give you spinal anesthesia, especially the ladies who are coming for Caesars. They'll say, I don't want to see, I don't want that one. Hey, what not what? You won't see what the surgeon, the doctor is operating, what the doctor is operating. We cover you nicely. We don't see the operation side. Even if we block the hand, for example, they operate on the hand. My little finger is broken. We can just block the little finger and then they operate. Here you still feel but the finger, there's no feeling. Then they can work on the finger. However, the finger is that side, you can block so that you do not see. Because some say, hey, I don't want to see knives.
So give me general anesthetic.
Give me general anesthetic. Yes. So those are the things that we do. So you can ask, which one am I getting? And sometimes understand why you are getting it. There's advantages and disadvantages of getting this. So you come and say, I don't want this one because I'm just scared. But if you tend to sit and listen to say, for your condition, you can get this one. Because there are other people with special conditions. It's good for them maybe to get a general anesthesia. Others with special medical conditions, it's good for them to get.
So you also do assess what is it that one needs to have. So it's not like you are given a choice based on what I think it's right, but it's about what is medically correct for me.
For you.
And even in terms of the procedure that I'm coming for.
We may be coming for the same procedures, me and you. We are coming for cesarean section, for example, me and you. I may get a spinal anesthesia, you may get a general anesthesia.
Oh, okay. Yes. I did not understand that one. I thought it depends what you are coming to do.
No, we look at the individual. It's about the individual. So we take history, we examine you, then we say and we look at the procedure. So, okay, for this procedure, And according to the history and examination that you have given us, this is what is best for you.
Thank you, Doctor. I see one of our listeners here saying, like now we are in ESCOM stage, load shedding. What happens when I'm still asleep? What are you going to do to wake me up? So maybe, Doctor, let us get to that time where you tell us, again, now you have given me that general anesthetic and I'm unconscious. How do you now bring me back? Because if it's about the light is gone. ESCOM.
I love this anesthesia job, Yeah. So basically, we don't use the light at all. You have a drip. You may not even see. Isn't that you are lying on the bed? You may not even see. We have an injection syringe on our hand. We are busy injecting a drug while talking to you. How many children do you have, Ceci? While we are busy with a syringe there's a drug that we give you to induce the sleep. Once we give that drug, you start feeling drowsy. But it's because you are looking at the light, of course.
Or
that's why people
make
think
us focus on the light, so that we think it's the light.
But we have a syringe next to us, a drug that we are busy giving.
All right.
Yes, we'll be injecting that drug. Then you feel drowsy, and then eventually you sleep. Then we can give another one to make you relax, muscle relaxation. After you are asleep now, then there's a tube that we usually, if it's general, there's a tube that we usually put in the mouth, goes through your throat. That's why sometimes tell them, even if you have simple flu, because people, they don't understand, it's just a flu. So because now I'm going to put that tube, it goes through trachea. Trachea is the pipe for breathing, and then it goes to the lungs. And then it will now give you oxygen. We connect you to the machine. So that machine is busy breathing oxygen.
So basically your body is not dead, doctor.
So pumping oxygen. While we are pumping oxygen to you, also there are gases that keep you sleeping. So we open those gases, they will keep you sleeping during the procedure. If you need pain medication, we are busy giving you
that pain medication.
Through the drip. So yes, as they say, if ESCOM now acts out, what happens now?
So what one of our viewers is saying that, hey, these people, it's like they are ministers in God's government, is right. No, that's a joke. Anyway, can continue, Doc.
So basically we have generators in our hospitals, and the machines that we use for putting what we call an anesthetic machine, it has a backup battery on its own, even if it's dark. So that one, there will be a backup battery that it won't switch off. Yes, and even if it switches off, as a professional, we know we have things for giving oxygen that stays next to us, which doesn't even need a connection to your ampoule bags, where you don't need to connect into electricity. So we just pump and then we give you oxygen, because oxygen, that's what is important. Yes. So people must not be scared. Hey, I'm not being operated in case there's no electricity. Yes.
Yeah, no, this is so empowering. I see our listeners busy saying next time they will have a great time with an anesthetic before they go for the procedure. So you can see, when you have information, you are relaxed. You go and want to be informed so that you can go there confidently. Last time she told us the importance of us taking medication or going for these procedures with confidence, because when you do not have confidence in something, the likelihood of it working is very minimized. Thank you so much, Doctor. We are only left with 15 minutes. We would like to take an ad break, and we'll be right back with you.
Ladies and gentlemen, here it is. Streaming 24/7. 24/7.
Bold Moves Radio.
Bold Moves Radio.
Africa, nakupenda sana. Oh, Africa, nakupenda sana.
You are right back with us. Bold Moves Radio. The show is Prudent Woman. Thank you so much for joining us. We are with you every Sunday, 6 o'clock until 7 o'clock. Tonight, we are with Dr. Mhlari Masingi. She's here with us, talking to us about medical procedures. We thank you, doctor. The information you are giving us is very empowering. You know, these are things that we never knew. And when you do not know something, we could not even ask our professionals when we go to seek for help, because most of the time when you go, you are already under a lot of stress. You have been diagnosed, you are panicking. What shall happen of me? So thank you so much for taking your time. Prudent Women, thank you for joining us, because together we can build our families. Together we can build this nation and be able to come out. Let us go out and talk to people to demystify the lot of myths that are there around procedures. Doctor, thank you for taking us through the different procedures, anesthetics that we have. But I will ask that, take us through, what is it that one needs to know before they go for a procedure? How do I get ready to go for either an operation or whatever that I'm going for, or a tooth operation, anything, just the basics? I see we don't have time now, but ladies, I would like to believe you'll go out. We have kickstarted the conversation. You'll go out and seek for more information around this topic.
What you need to know before you go for procedure, as I mentioned, the diagnosis is important. Know why you are being operated. There are so many things out there. You may just be operated just because. So you know why you are being operated. And know the type of anesthesia that you will be giving. Discuss with your doctor. And even when they come and see you in the pre-operative visit, ask. Don't be scared to ask. Yes. So what I want to emphasize that I see that is happening, we want our patients staffed. We must not eat the morning of the surgery. Yes. So most people, they come and we ask them, have you eaten? They say, no, we haven't eaten. Because their neighbor told them that if you have eaten, they won't operate you. So please don't hide such information, because it's very crucial. You may hide, as I say, once you are sleeping, all the muscles relaxes. Even if I didn't give you anything, now you are in a relaxed state, then the food that you have eaten, it may come out on its own.
Okay.
And now you are sleeping. Remember, the pipe for breathing and for eating, they're just lying next to each other, on top of each other. So now, if the food comes out, where will it go? To the next door pipe.
So there can be complications.
There can be complications. You just go into the breathing pipe now. And you don't want food in the breathing pipe. It means it will block the breathing pipe. You won't be able to, so many complications there. So don't hide such information. Even if you have eaten, they may just say, okay, let's postpone you for that particular day. We'll do it in the afternoon instead of morning. Wow. Even if you have taken some drink, just inform the one who will be putting you to sleep. Issues of flu. Some people say, flu is not a disease. Let me not mention it that I have flu. As I mentioned, if we're doing the general one, we go through the pipe for breathing. So if you have flu already, there's irritation there. So if it's not an emergency, we may postpone you for your sake, and then treat the flu. Then you come back when you are fine. Sometimes we just want to be operated. Say, hey, I've been postponed so many times. I've been in a waiting. It depends. You are in a waiting list for quite some time. Sometimes we were cancelled several times. So just don't withhold that information. Allergies. Remember, we are using a lot of medication. We deal with a lot of medication for one procedure to put you back to sleep and to wake you up. It's all about drugs.
Yes. Yeah.
So please, any medication that you are taking, drugs that you are taking, Usually we'll direct the questions once we come and speak to you. We'll ask you, do you eat such a thing? Are you allergic to fish? Are you allergic to peanuts? Why are they asking me? I'm allergic to fish, peanuts, such silly questions. Those things are important. Some medications who are made out of all those things. And if you are allergic to them, automatically may be allergic to the medication. So family diseases. So there are certain diseases that we may ask you, just mention, it's important for you to mention if you have hemophilias, all those kind of things. Mention, and your own chronic medication. Need them. Even your social habits are important. Alcohol, drugs.
Yeah, one of us was asking that, do you have to disclose if you were a former drug addict?
Even if you are a former, or it's very important, former, current, even simple things like just alcohol. Even if you're not addicted to alcohol, just
but if you
drink, yes. And smoking is important.
And I guess that is the reason when you complete those forms, mostly if the patient is okay, they will want you to complete them alone because they are confidential. And we tend, I know with us ladies, and you want to follow. I have noticed that when something is confidential, sometimes to get the best out of it, let the person go and answer them alone. Because can you just imagine if you think your partner is not drinking and you forced to go with them as they answer, they are likely to lie. And imagine with what doctor is telling us that it can hamper the success of the procedure. So that's the reason confidential documents, let us treat them as confidential unless a situation where they are not able to do it themselves. But Luana, be honest, I told you last week that, when I was doing it, I thought I was taking the doctor's time. But I felt I need to do it when my son was going for procedure because I kept on explaining a lot of things. When they were asking fish, I didn't know what he was allergic to, but I knew what he ate. That brought along the allergy. And this medical practitioner said, oh, you are one of the few who could think of something like that because that will have had a major impact. We're going to use something that will make him react. Probably he was not going to wake up. Because now that you have told us, they used a different method to bring that relief for him. Doctor, thank you so much with all this information. But I know probably you have tips on how, most especially when we go for these procedures, how should I look like? My dress code, makeups, and all these things. I have seen somewhere they saying it's very important. So can you please advise us? How will you want us to present ourselves? When I'm coming for the procedure, or how should I be presented?
Yes, thank you. Anesthetic-wise,
yes.
Number one, nail polish. So don't go for manicure. When you're going for a procedure to be operated, you are going to remove this, and you just paid money yesterday, and you are going to cry, and we are going to fight.
Wake up.
This has to be removed anyway. We don't want a nail polish. We don't want whatever you call this nail, whatever. We don't want anything. We just want our nails because, as I said, we put you to sleep. A machine breathes for you, so we need to monitor you. Are you breathing well and all the stuff? So whatever we use for monitoring to breathe well, we attach it on your finger.
Okay.
So the finger will tell us now, will detect if you are breathing well, detect the blood in the blood capillaries if you are breathing well, and tells us, the lungs are okay, they're getting enough oxygen. We're going to remove your nail polish. Then the hairstyles, because people now they think they must look good. They go put this ponytail, the one which looks like mine.
Yeah.
So, but this one is removable. Don't worry. The fixed one. So want to position you so that we can intubate you. Put a tube in your, so it's difficult now to position you proper with that hairstyle. Yeah. So we end up taking a razor, we cut it, and then we fight with you
when you wake up.
So if you have false teeth,
Okay.
Just inform us if these are false teeth, because
Take
if I
them
put
off.
my gadgets now to put it to sleep, they start falling.
Okay.
Yes, and if they can fall, they can also go and block the breathing pipe. So all those things. So please do not eat in the morning.
Okay.
Or a day before, and then they will tell you the duration.
Yes.
Of the surgery. Even if it looks like it's a small procedure, do not eat.
Okay.
So have information, be informed what you are going there for. Yes.
No, this is so empowering. And, we are told, sometimes we think, this nurse wants me to take off my manicure. I'm not. But I think tonight, ladies, we are empowered. We now understand the purpose of the different requests that our medical practitioners will give us before a procedure. And we are empowered to understand why we need to undergo procedures. So they will not say you have to do this if it's not important. Ours is to ask questions. When we have understood, we obey, isn't it, doctor? So you must first understand. From there, you obey the doctor's orders. I love it, doctor, because most of the time, even ourselves, if I have a loved one who has been diagnosed, I do not even care whether they understand what is it that they have been diagnosed with, but I just want them to obey the doctor's regulations. You can obey something with understanding. When you do not understand something, the obeying part becomes so difficult. But tonight, I would like to believe, ladies, we are now ambassadors. We're going to demystify procedures. We are going to take advantage of the medical science that the Lord has given us through our medical practitioners in order to make our families live a healthy and a fulfilling life. Thank you so much, doctor. It was empowering. But before I give our doctor time to tell us what she would like to leave us with, I know she always has wisdom words for us in terms of our health, how to conduct ourselves. I would like to go back to last week. You remember we had a competition. We said we would like to give away 2 tickets, mother and a daughter, to the people who will tell us what was our theme for the month of June. Yes, the month of June, many of you said month of June we're celebrating young people. Some said Father's Day, a whole lot. But our theme, we said as Prudent women, we were celebrating Youth Month by writing better letters. We said God has given us our children, and they represent letters that we write to the future. And we can only write better letters when we are informed on how to raise them, how to have good relationships with them, how to help them undergo a lot of different challenges that society has in today's life, like dealing with issues of drugs, how to educate them on the dangers of drug abuse, a whole lot of topics that we have spoken on. So our winner is Mrs. Sinkuna Onika. She won the 2 tickets, a mother and a daughter. And remember, we said, even if you do not have your biological daughter, we would like you to invite that young woman to come to Abigail Arise conference. Let them come on Friday, relax, love themselves, enjoy. And on Saturday, let them be empowered. So Sesi Onika Kuna, you are our winner. And thank you so much for watching Prudent Woman. We appreciate, for we know you are becoming ambassadors and you are educated as much as even myself. I'm empowered. You cannot believe how fulfilled I've realized it is to have time where I research on all these different topics. And I've realized that by the end of this year, I will not be the same person. Having people that you converse on different topics, it's so wonderful. And I would like to thank, tonight we have a male, Dr. Mabila Matebula. You know, this man is not our producer. He was not on the panel, but I love his zeal. He's always on our show, and he took it upon himself. Ladies, I invite you, continue being on this platform. He has got powerful women whom he has identified in his area of specialty. He's bringing them on to the show just to empower us. I love it because it comes from a man. And I love our executive producer, Pastor Strag. He's always here with us. Some of you may think he's not here because he does not comment, but he says he wants the ladies to converse. Our executive producer, Pastor Strag, would like to say thank you so much, because this show will not be what it is without you. And of course, our co-producer, our young person, Nyeleti Baloyi, we love you, girl, and we trust that you are learning. By the time you start your own family, I know you will not be the same. Prudent women, let us continue and empower ourselves with information as we get ready to change the world by changing our families first, and then we go now to Judea. Thank you so much. Dr. Tsagani, back to you. Can you please give us your parting shots? What is it that you would like to leave us with, even as ladies we get ready? Next week, we are talking to our dietitian and our psychologist on binge eating. You know, most of us, when we are not well taken care of mentally, we eat. You hear someone chocolate because things are not going right. And we say, let us address these issues. Even as we continue in the month of July, it's Mental Health Awareness Month. Dr. Mhlari Masingi, please, your parting shots.
Anesthesia is for your positive, is for your own good, because it's going to take care of your pain. Yes. As we said, pain, muscle relaxation, and hypnosis. So let's not be scared. To have fear, it's something that we cannot take away. But once we have information, we can conquer the fear. Thank you so much.
Thank you so much, Dr. Mhlari. Yes, phobias, fears, and anxieties can be dealt with when you are knowledgeable. I would like to leave you with that. Let us have a beautiful week. Even as we get ready for Abigail Arise Conference, we shall see you on Friday. Have a blessed evening. Take care. Thank you.
Ladies and gentlemen, here it is. Streaming 24/7. 24/7. Bold Moves Radio.
Africa, nakupenda sana. Oh,